So today we're following up with one of our postpartum mamas. We've previously treated her with a picosecond laser to get rid of her linea nigra, which looks great. We only did 2 treatments, and that was the first step in helping her on her postpartum journey. And today what we're going to do is we're going to try to tighten this area right above the belly button that a lot of women complain about post-pregnancy. And we're going to do 2 different treatments on her. One is Ultherapy, followed by Vivace Microneedling. So the goal here is to try to take this tissue here over her belly button and kind of, like I tell patients, we're going to turn that frown upside down. And then we're going to microneedle over to help with some of this crepey skin. Results are generally seen after any sort of heat-based device, roughly 3 to 4 months afterwards, so don't judge right away. We have to stimulate collagen and get everything tighter. It typically requires 1 treatment of Ultherapy and 1, maybe 2 treatments of Vivace that we will evaluate in about a month to see if she needs an additional treatment, but she's a great candidate, and we're going to get started. Okay, so here we go. We're going to start with Ultherapy. We put a little bit of ultrasound gel over the belly. And I'm looking at my ultrasound now to make sure we're in the right depth, which we are, and that only comes with experience in doing Ultherapy. So here we go. So this treatment is delivering micro-focused ultrasound deep into the tissue in order to stimulate collagen. We are purposely injuring the area so that her body then sends healing properties, lots of blood flow to the area to produce more collagen, thus increasing elastin and collagen. Just overall tightening. Ultherapy on the abdomen is a great postpartum treatment for those who are not candidates for a tummy tuck. We always caution in telling patients this is not going to be like a tummy tuck, but for those who are not candidates or who just don't want to go through a big procedure like a tummy tuck, this will help to tighten the area and really help to lift up that belly button. But we always have to choose the right candidate, make sure that the patient is back down to their ideal weight or at least close to, and someone who has realistic expectations. We expect a pretty significant improvement, but it's not going to be like a tummy tuck. But for those who just don't want to opt for that route, this is a really good option for them. And the subsequent Vivace treatments will further tighten the area. So when I treat the abdomen, I approach it a little differently than I do the face. With the face, I'm using 2 different transducers, different depths, in order to treat specific areas of the tissue. So typically on the face, I'll do 2 different transducers. On the neck, I'll do 2 other transducers. On the belly today for her, I'm going to use a combination of 3 different transducers because the skin quality on the belly is a little different. So she has some thicker tissue that can tolerate a deeper transducer, but when we go over the area right above her belly button, I'm going to use a nice superficial transducer that's really going to help with this kind of crinkly appearance and texture. And that's a little gem for all you Ultherapy experts out there. Finished part 1 of our abdomen mommy makeover using Ultherapy. So this is very common. This is the reaction that you want. These red kind of stripey lines happen pretty instantly, but there's no pain afterwards. It's just a little red and kind of a bit of an eyesore for a day or 2. And we purposely did that to try to treat some of the crepiness. When we just treat deeper depths, you will not see any of this redness, but this is the exact reaction. Nothing to do, nothing, no topicals or anything to get this to go down. We want inflammation. Inflammation is what stimulates collagen. So just try to deal with it for a day or 2 and it'll be gone probably by tomorrow morning, or if not the following morning. You can experience sometimes a little bit of itching. That's a sign of healing, completely normal. So now we're on to part 2, which is one of my favorites. This is Vivace Microneedling. And we're gonna go over the same area to try to treat a little more of the crepey texture. This treatment may require an additional treatment, and I'm gonna start in a deeper plane using a 3mm microneedle. And it's pretty tolerable. Wouldn't you agree? Okay, it's pretty tolerable. We're just treating the deeper tissue first, and I'm going to go over this area with 3 different passes, a deep, a mid, and a superficial. So I'm following up with my patient that I did Ultherapy and Vivace on post-pregnancy to help with some of the crepiness, some stretch marks. We're 6 weeks post Ultherapy and very aggressive Vivace on her belly, and the difference is quite remarkable. We're not even at the peak in terms of how much more improvement we're going to get. I expect over the next 6 weeks this is going to continue to tighten, but notice the difference in her stretch marks. They are significantly improved. The belly is much tighter, especially above the belly button. The texture of her skin is nice and smooth. You don't feel any rippling anymore. We're doing a nice close-up so you can see there are no tricks here. We also treated this line, this linea nigra, with a pico laser. So for all of these postpartum mamas coming in, there is hope for the belly. You just have to be patient, understand that there will be a little bit of downtime on the belly. When we treat this area, we tend to go pretty aggressive. And she had about 3 weeks of some light peeling in the area, a little bit of mild tenderness just during the procedure, but the results are pretty significant. So we'll show the before and afters.